Welcome to our channel, Med Enigma. Today we are continuing our dermatology section. Its topic of discussion today is acne and rosacea. Acne and rosacea are quite important from the clinical point of view as well as from the exam point of view. So you must understand these concepts clearly. These are our learning objectives. By the end of this lecture, students will be able to define acne and rosacea. Okay, you must understand these concepts clearly so that you understand its pathogenesis and how these conditions occur. Identify clinical features of acne. Clinical features of acne are quite important, but they are sometimes obvious. We can easily pick them. How they present in different ages groups or in different variants, and that is important. So you will be able to tell them about once this lecture is over. Next up, we will discuss classification of acne, how its different variants and how they are classified. Outline its management. Now this is important. As much as diagnosis of acne is important, its treatment is also quite important because patients have concerns regarding its treatment and how will this acne will solve itself. Now, next up is recognize complications of acne. Okay, so complications of acne are quite the important thing because these are the main concerns of a patient. Once the acne heals, then we have got its complications, and they are much worse than the real condition because they persist and they leave permanent scars, and those are quite disturbing for the patient. Next up, describe clinical features of rosacea. Okay, so after discussing acne, we will be moving on towards rosacea. We will discuss its clinical features and how it differs from acne because both the rosacea and acne presents in the same way, but we are going to differentiate them and tell them about how they are different, whether it's acne or whether it's rosacea. So these are our learning objectives of today's lecture. I hope you stay with me. Okay, let's begin. So today we are going to discuss Acne Vulgaris. Acne Vulgaris, this is, now let me tell you its explanation. Acne basically, acne has different forms and different variants, but here we will be discussing Acne Vulgaris. Why? That's because vulgaris word, this word is derived from the Latin word which means common. So this is that variant of acne which is quite common compared to the other variants, compared to its other types. So this is quite common in adolescent, in young adults. So that's why here we are discussing acne vulgaris, and most of our topic will be covering this section. Now, next, moving on to this acne vulgaris. What is acne vulgaris? This is its definition. You must understand this concept clearly. Okay, chronic inflammatory disease of pilosebaceous unit. What does this mean? Now, let me explain what is pilosebaceous unit. Pilosebaceous unit we will be discussing later in our later slides, but let me here mention it briefly. Pilosebaceous unit. Pilosebaceous unit includes our hair follicle, sebaceous glands, duct, hair follicle duct, sebaceous gland duct, and the pores. This is all about pilosebaceous unit as well as the sebum. So they all come together and make this unit that is called pilo. Pilo means hair, sebaceous means sebum. So pilosebaceous means hair follicle plus sebum are sebum producing glands. Both they form they combine together and form this pilosebaceous unit. Now the chronic inflammatory disease of this unit, hair follicle and the sebaceous glands, that is called acne vulgaris. Acne vulgaris is basically the inflammation. It is inflammation of pilosebaceous unit. We will be discussing it in our later slides. So this is the chronic inflammatory. Once we discuss its pathogenesis, then you will be able to understand this definition very clearly. Okay, you don't need to worry about it right now. That what are these difficult terms? They are not difficult at all. We will be discussing them in detail in our next slides. So next, moving on, then we have a characterization of acne vulgaris. It is characterized by both inflammatory and non-inflammatory lesions. There are two types of lesions that are found in acne vulgaris: inflammatory lesions and non-inflammatory lesions. What are those lesions, and how do we define them? That will be also discussed in our later slides. It commonly affects adolescents and young adults. This is very important. This is so much important that that's why we called it as acne vulgaris, because vulgaris word is given to this acne because this is the commonest form of acne. It occurs mostly in adolescents and young adults. Okay, now then next up is the sites involved. What are the sites that are involved in acne? Mostly it's face, chest, back, and shoulders. Whenever we are inexperienced or amateur students, or in the clinical wards, we don't have much experience, then we on our daily observation we mostly think that acne is only limited to the face, but that's not true. Once you will go to the clinical wards, once you interact with patients, then you will notice that acne doesn't only limit to the face, but it spreads to the chest, to the back, to the shoulders. Another important point is that it doesn't goes beyond the umbilicus. That is, it doesn't involve lower limbs. So acne will involve upper limbs as well as trunks. In trunk we have chest, back, and shoulders. All of these could be involved in acne vulgaris. Okay, now that depends upon the severity of the disease. Most commonly, the form of acne that you see most commonly in the young adults or in females, that is facial acne, but that involves only face. But in males, sometimes its form is quite severe. So in males, it will involve both chest, back, and shoulders. Okay, but it will not involve the limbs. That is the point to remember. Okay. So this is the pilosebaceous unit. Let me explain it clearly once more. You see here, this is the hair follicle, this shaft. This is the hair follicle. The thing attached to it, next to it, is sebaceous gland. This is the sebaceous gland. Pilo means hair and sebaceous means sebaceous gland. Pilo hair follicle and sebaceous gland, they both combine together and form this unit that is called sebaceous unit. Why do we call it a pilosebaceous unit? Just look at this. The sebum, sebaceous gland, and the hair follicle, they both have a single duct, single common duct, this common duct. That's why we call it as a unit, that they both act as a unit. Now they both open towards the surface, or they both open towards the environment with the help of this pore. This is the skin surface. Now what happens in the acne? Mostly acne occurs because of the androgens. Now what happens? I told you that it is common in the adolescents or young adults. Why? The question must be arising in your mind, then why it involves only adolescents and young adults? Why not before that age? That's because in adolescent and young adult age, we have got puberty. That is the age of puberty. So in that age, secondary sex characteristics starts to develop. Why? Because both males and females start secreting hormones which are called androgen hormones. Those androgen hormones have serious and drastic effects on these sebaceous glands. But now what happens is that excess androgen will act upon these sebaceous glands. These sebaceous glands then will start secreting sebum. What is the function of sebaceous gland? To secrete sebum, right? So under the influence of androgens, these sebaceous glands start secreting sebum. Now what happens? They go hypersecretion. They undergo hypersecretion. So not only normal amount of sebum is not produced. It's the hypersecretion of sebum that induces produces the acne. So how it happens that once this these sebaceous glands produce excess amount of sebum, that sebum clogs these ducts. This duct you see here, this duct is clogged by the excess sebum. Now, this is the first step that happens in the pathogenesis of acne. So first step is the rise of androgens. Once the androgen level rises, then we have got sebaceous gland activity, hyperactivity, and that hyperactivity will lead to hypersecretion of sebum. With that sebum, excess sebum will accumulate in these sebaceous glands and will occlude this duct. What happens next? Then what happens is that these hair follicles you see here, they will start hyperkeratinization. What is hyperkeratinization? I have already told you in my previous lecture that the hair follicles and the skin mostly contains keratinocytes. Now the hair follicles are lined by keratinocytes. Once these pores are clogged by the excess sebum, they start proliferating. So their population increases, and we have got hyperkeratinization of hair follicles. That is the second step in the pathogenesis of acne. Hyperkeratinization of hair follicles. What happens then? This hyperkeratinization, it will prevent the dead keratinocytes from being released from the skin or being shed off or peeled off from the skin. They won't shed off, so they will accumulate in the hair follicle. Hair follicle will also dilate, and then we have got excess sebum, and now we have these dead keratinocytes, proliferating cells with dead cells, and these cells, everything. Now here next, the third step in the pathogenesis of this acne is that there is a bacteria that is called Corynebacteria acne. Corynebacteria acne. Okay, that bacteria, what does it do? When this new environment becomes favorable for that bacteria to grow. It's an anaerobic bacteria. It doesn't need any oxygen to function properly. So here this environment is anaerobic. So what will happen, that this bacteria will start growing. Once this bacteria start grow in this pilosebaceous unit, which has now become dilated with the excess sebum and the dead keratinocytes, then where due to the division of Corynebacterium acne, that bacteria, what will that bacteria do? That bacteria will release inflammatory mediators. That bacteria, what will bacteria do? That it will release inflammatory mediators like interleukin 1, 2, 3 and things like that. Okay, now under the influence of those inflammatory mediators, the skin will start getting neutrophil infiltration. Okay, neutrophils will start coming from the blood and will accumulate here, and those neutrophils then start to lyse this condition, and that's where the inflammation begins. Once the inflammation begins, then we have got these prominent features of papules and pustules in the acne that we most commonly observe in our nearby. Okay, so that is the whole pathogenesis of acne. Now here we will be discussing it again. This is the pathogenesis. Increased sebum production, first of all, but the first step that will induce the acne, that is, it's called increased sebum production. And then we have got follicular hyperkeratinization, and then bacterial colonization, and then we have got inflammatory reaction, which will present as pustules, nodules, cysts and papules. Okay, this is the pathogenesis of acne. Now we will be discussing it in detail one by one. Increased sebum production. Why the sebum production has increased? It's because of the androgen. The puberty induces androgen to be secreted from the glands. Now those androgens stimulate sebaceous glands. Under the influence of androgens, sebaceous glands start secreting excess sebum. That sebum creates lipid-rich environment, and which is a favorable environment for the bacterial growth. Okay, so that environment will promote bacterial growth. Next step is the follicular hyperkeratinization. How does it happen? That under the influence of those androgens, keratinocytes starts proliferating. Now their population start increasing. Blockage of follicular opening. Follicular opening gets blocked because of the dead keratinocytes as well as the new proliferating keratinocytes. Now, because we have got a bulk of cells now. Formation of microcomedone. What are those comedones? Comedones, I will be discussing them later in our later slides. What are comedones? But here you must remember these are white heads and black heads that you most often hear about. So you must have seen them sometimes, maybe on yourself or in your colleagues or nearby individuals. Formation of microcomedone. First step, that is the first step in the acne development. Okay, once the microcomedone, because these are the non-inflammatory lesions I talked about earlier. Okay, now what happens? Bacterial colonization, because now the environment has been set up. Now the bacteria will start colonizing this environment. Cutibacterium acnes, or I pronounced it incorrectly. Here the bacterium name is Cutibacterium acnes. Cutibacterium acnes. What will it do? It will colonize the blocked follicles, because that blocked follicle has excess sebum, lipid-rich environment, as well as it has dead keratinocytes. So it's a perfect environment for this bacteria to grow. Now, what will it do? It will start breaking down sebum. Once the sebum is broken down, it will release free fatty acids, and those free fatty acids are like inflammatory trigger markers. Those free fatty acids will cause inflammation, will cause release of interleukins, and then neutrophil infiltration. That neutrophil infiltration will produce inflammation, that is pain, erythema, and color change, and all those signs of inflammation will appear. Inflammation, release of inflammatory mediators, neutrophil infiltration, rupture of follicle. Once the neutrophil infiltrates, follicle ruptures because it has already been dilated by the excess amount of Corynebacterium as well as by the hyperkeratinization. So now it will of course rupture. That rupture will lead to the papules and pustules, because now we have got bacterial infection. So papules and papules are the lesions. Now here we will be discussing acne lesions in details. We have got two types of acne lesions.